This Good Morning Washington Spotlight on Your Health is sponsored by George Washington University Hospital.
This morning, our Spotlight on Your Health is taking a look at pulmonary hypertension. Dr. Mardi Gomberg is joining us here to share more on that now. Welcome to the show.
Thank you so much for having me.
So let's start with what is pulmonary hypertension and how is it different from high blood pressure?
Sure. Pulmonary hypertension is high blood pressure in the lungs, and it can be from anything that affects the heart and the lungs and causes a stress on the lungs such that the pressure has to go up. I like to think of it as a plumbing system, and if the heart is under pressure, and the heart is a muscle, it gets stronger. The flow backs up, and where does it back up into? The lungs, and then into the body, and these patients get heart failure. So, it's a type of heart failure from the high pressures in the lungs.
So let's talk about how you diagnose hypertension, and you can go and get tested easily for high blood pressure, but it's not as easy to test for this.
Exactly. You can't put a blood pressure cuff around the lungs. I mean, it just doesn't work.
Right.
So what you have to do is, one, you have to be thinking about it. And these patients present with shortness of breath on exertion, and unfortunately, we're still not doing a very good job. Patients come to us when they have that symptom, and they're already far along. So you have to be thinking about it. It's not always asthma or just trouble breathing or anxiety. It can be high pressure in the lungs. And so you need to do a cardiogram, and what's most important is an echocardiography. This is the screening test that shows that there could be high pressure in the lungs. It's an estimate, and it should be the basis for referral to a comprehensive care center, because ultimately you need to measure the pressures from the inside. And we do that by putting tubes into the heart and lungs and measuring the pressure, called a cardiac catheterization.
There have been a lot of advancements when it comes to treatments just in the past 20 years. Let's talk about that.
Yeah, so when I started out, all we had was intravenous therapy. It was a 24/7. It was as if you took the ICU home with the patient. Now we have multiple oral therapies and inhaled therapies, such that we're only using the IV up front if they're super sick. And so it's really made the disease manageable. I have some patients that come from Chicago that have been falling for 20 years, and that was unheard of because we still don't have a cure.
Wow, and that is remarkable and very encouraging to know that. With all those advancements, talk about why it's so important to make sure you're seen at a comprehensive care center.
Yeah, so GW is the only comprehensive care center here in DC. So that's really important to point out, because what a comprehensive care center allows is a multidisciplinary team. So irrespective of the type of high pressure in the lungs you have, we make sure that you see the right specialist. And in the hospital, you really need a team that understands the disease, because these patients get very sick very quickly, and you want folks that are aware of high pressure in the lungs.
For someone who's watching right now that may be suffering from this or have a family member that's suffering from this, what's the best way to get more information and get started?
Yeah, so there's a couple of ways that you could do that. One, you can go onto the website and look at GW Hospital, because we are the only practice in DC that's a comprehensive care center. The comprehensive care centers are established through the Pulmonary Hypertension Association, so you can go to that website as well. And frankly, there's going to be a ton of stuff on it this month, because November is Pulmonary Hypertension Awareness Month.
Wow.
So.
Well, thank you for sharing this important information. All the information on the screen if people want to learn more. And thank you so much for coming in today.
Thanks.